Hello everybody, my name's Ashley Sharon and my project was on Tourette syndrome. Tourette syndrome is a severe neurological disorder characterized by multiple facial and other body tics, probably based on differences in or damage to the basal ganglia of the brain. Tourette syndrome usually begins in childhood or adolescence and is often accompanied by grunts and compulsive utterances, as well as interjections and obscenities. The exact cause of Tourette syndrome is unknown. It's a complex disorder likely caused by a combination of inherited and environmental factors. Chemicals in the brain that transmit nerve impulses, which are neurotransmitters, including dopamine and serotonin, might play a role. Sudden, brief, intermittent movements or sounds are the hallmark sign of Tourette syndrome. They can range from mild to severe. Severe symptoms might significantly interfere with communication, daily functioning, and quality of life. According to the CDC, for a person to be diagnosed with Tourette syndrome, he or she must have 2 or more motor tics, blinking or shrugging the shoulders, and at least 1 vocal tic, humming, clearing the throat, or yelling out a word or phrase, although they might not always happen at the same time. They must have had tics for at least a year. The tics can occur many times a day, nearly every day, or off and on. They must have tics that begin before he or she is 18 years of age, and they must have symptoms that are not due to taking medicine or other drugs or due to having another medical condition such as Huntington's disease or post-viral encephalitis. There's no cure for Tourette syndrome. The condition often improves as the individual matures. They live a normal lifespan. The condition is often lifelong and chronic, but not degenerative. In rare cases, complete remission occurs after adolescence. Hypokinetic dysarthria is associated with Tourette syndrome. This is a voice disorder where damage to a part of the brain called the basal ganglia affects muscle tone and causes involuntary movements of the muscles involved in speech. Some symptoms are slow speech rate, inappropriate speech interruptions, tremulous voice, strained voice, voice stoppage, harsh voice, nasal voice, inappropriate loudness, or vocal noise. The basal ganglia is a site for 2 influential neurotransmitters, dopamine and acetylcholine. Balance between these 2 neurotransmitters is important for motor control. Regulation of amplitude, velocity, and initiation of movement is associated with the basal ganglia. It probably aids in the generating components of motor speech programs, and it modulates cortical discharges and suppression of unwanted movements. There's no cure for Tourette syndrome. Management of Tourette syndrome includes behavioral, psychological, and pharmacological treatments. Speech-language pathologists can also help with co-occurring conditions and other symptoms that interfere with functioning. There is no universal medication that works for all individuals. These medications below have shown to work for some patients with Tourette syndrome. Haldol, Orap, and Prolixin control tics by blocking dopamine receptors. Catapres and Tinex are high blood pressure medicines that can also control tics. Botox, when combined with voice therapy, have been shown to improve phonation. Some behavioral treatments for Tourette syndrome are habit reversal therapy. This increases the person's sense of when a tic is about to happen, so they are more able to control it. Relaxation therapy is used to reduce the stress that a person with a tic disorder experiences. Cognitive behavioral therapy focuses on helping people to change both their thinking and how they act on it. And breath control is also used as a treatment therapy. Treatment of respiratory and phonatory deficits. The simple and complex vocal tics in Tourette syndrome differ in speech production. Bird, Christensen, and Kervishane, however you say that last name, explain that with simple vocal tics, children often incorporate poorly synchronized sequences of respiratory, vocal cord, and oral articulatory mechanism, while complex vocal tics may include a sequence of simple motor tics, interruptive phonemes, or pragmatically misplaced verbalizations. Biofeedback is often used as a treatment option. Using a combination of therapeutic skills and instrumentation, therapists initially teach a patient to monitor and control an external signal during therapy sessions, and eventually the patient is able to self-regulate using internal sensations and cues, also known as sensory memory. Postural adjustments are also used. and non-speech tasks such as practicing an effective breathing pattern, practice switching between inspiration and expiration, using techniques that address hyperreduction, and also the use of strengthening exercises. The treatment of rate can include the use of pacing devices, metronome pacing, rate modification, which allows time for a full range of movement and increased time for coordination, and delayed auditory feedback. Prosody attempts to preserve naturalness. Some treatment therapies that are used for prosody can be visual feedback, which is the use of mirrors and or computers to provide additional feedback of speech behaviors, verbal feedback to reduce inappropriate pauses, and rhythmic cueing can help an individual with Tourette syndrome give appropriate emphasis to stressed phonemes and prominent words within conversational speech. Treatment of intelligibility can include exaggerated articulation, which places emphasis on production of syllables, shaping, successive approximation, imitation, and rhythmic cueing. AAC devices are usually used with co-occurring conditions, the use of gestural communication, symbols, message transmission devices such as communication boards or speech generating devices are used. Here's a list of the resources I used.